neobium activated, it will give up blue or UV light. So for gadolinium oxysulfide and terbium activated, in case if this phosphor is present, we'll have to use films that are sensitive to green light. In case if we are using atrium tantalate neobium activated intensifying screen, then we'll have to use films that are sensitive to blue light. Now coming to the types, there are three types of intensifying screens: standard screens, which are slow screens; rare earth screens, which are fast screens, or combination. So standard screens will use calcium tungstate phosphors, and rare earth screens will use gadolinium or lanthanum phosphors. So these rare earth phosphors are more efficient at converting X-rays to visible light, and thus it reduces the radiation to the patient. Okay, the manufacturer's name, type of the screen are printed on this one side of the screen, and this information appears on the radiographs. So almost all the cassettes will have intensifying screens on which there will be the information of the manufacturer's names as well as the type of the screen. And after you process, the same will be seen on the film also. The speed and resolution of a screen depends on many factors. So there will be the type of phosphor that is used, the conversion efficiency of this phosphor, the thickness of the phosphor layer, and the presence of reflective layer, presence of light absorbing dye, and phosphor grain size. All these will be responsible for the resolution of the image produced by the screen. So these are various speeds of the selected rare earths. These are various speeds that are of the rare earth screens. Next, now coming to the composition of the screen. So intensifying screens are again made up of base supporting material, phosphor layer, protective polymeric coat. So there will be a base upon which there will be a phosphor layer. Again, upon phosphor layer, there will be a protective polymeric coat. In all dental applications, intensifying screens are used in pairs and are positioned inside a cassette. As I told you, there will be there will be a pair of intensifying screens, right? One on the upper side, one on the lower side. Purpose of the cassette is to hold each intensifying screen in contact with the X-ray film. So there will be a cassette, right? Inside the cassette only, there will be intensifying screens on either side. The basic purpose of the cassette will be it will hold the intensifying screen and see that both the intensifying screen on both the sides will come in contact with the both the sides of the X-ray film. So the base material is made up of polyester plastic, which is about 0.25 mm thick. This will give mechanical support to the other layers. In some intensifying screens, the base is reflective, that is, it reflects light emitted from the phosphor layer back toward the X-ray film. So this film, so after crossing the phosphor, whatever visible light that is coming to the base, it will reflect back to the film. That is one quality if in case if the base is reflective. This has an effect of increasing the light emission of the intensifying screen. Now coming to the phosphor layer, it is composed of phosphorescent crystals suspended in a polymeric binder. So these crystals will absorb the X-ray photons, they will fluoresce, and the phosphor crystals often contain rare earth elements like lanthanum and gadolinium. So their fluorescence can be increased by the addition of small amounts of elements called as thulium, niobium, and terbium. We have learned saying that thulium activated, niobium activated, and activated by terbium, right? All these elements will increase the amount of fluorescence, thereby increasing the amount of visible light, thereby forming a proper image. So if you see, this is the to protect the phosphor. The protective coat is nothing but it will protect the phosphor. Okay, it will be up to 15 micrometers thick. So this is the base. If you see, this is the base. The base again will have a reflecting layer. Then the yellow colored thing is the phosphor layer, and there will be a protective coating. Okay, there will be a base. So the base can have a reflective layer. So the phosphor and protective coat. So again, as I told you, the thickness of the phosphor layer, crystal size, based upon the reflective layer, absorbing layer, and the presence of dyes in the phosphor layer, there can be differences in the screen speed, recording the details and the patient exposure. Next, coming to the cassette. So a cassette is a flat, light tight container which will have X-ray films that are placed for exposure to ionizing radiation and usually backed by lead to eliminate the efforts of backscattered radiation. Again, on the backside, there will be a lead. Cassettes are used in association with intensifying screens and screen films. So whenever you have you should use an intensifying screen with screen films. We need a cassette. So the functions will be to contain the film, to exclude the light, to maintain the film in close uniform contact with both the intensifying screens on either sides of the film during an exposure, to protect the intensifying screens from physical damage. Okay, these are the various functions of the cassette. And standard cassettes will consist of two flat rectangular plates hinged along one edge. So the front aspect of the cassette faces the X-ray tube and consists of a sturdy metal frame into which is fixed a sheet of either light metal such as aluminum or plastic material. So the frame will constitute a shallow container into which it can be placed thin intensifying screens and a film. So there will be a sturdy metal frame for this cassette on the peripheries of the cassette. So if you see this is the cassette, if you see the cassette, it will look like this. So there will be a metal frame on all the four corners, and this centrally there will be plastic, and this is how you have to open. After opening, there is intense white colored intensifying screen on either sides of the cassette, and this is the film which has to be placed in between both the intensifying screens. So if you see, this will be the front screen. So there will be a reflecting layer, there will be a phosphor, again there will be film. Film again will have emulsion on both sides and there will be a base. Again on our back side there will be phosphor and reflective layer. This is how the composition of intensifying screens along with the films will be present. So again, once again, if you see, this is the composition of the entire cassette. Okay. So this is the uh, cassette, the outer plastic covering of the cassette on the front side. There will be foam, and there will be a screen support. Okay, foam and screen support will be there, and that will be a phosphor or coating. Then centrally film will be placed. Again, the phosphor or coating of the intensifying screen will be present. There will be screen support. There will be foam, and then there will be the backside of the cassette. This is the composition of cassette. Okay, this is how you see this is how the cassette will be present. Next, coming to grids. Okay, that is all about intensifying screens. Okay, that is all about films and intensifying screens. Okay, grids we will see in the next class. Attendance. What about attendance? All are present? Shita, what is the name of the CR of your class?
Abhinav, ma'am.
Good morning, ma'am.
Now you're going to get the attendance to the class, to the department.
Yes, ma'am. I'll get it to the department, ma'am.
I didn't get you. Your voice was not clear.
Ma'am, I'll bring the attendance to the department, ma'am.
How do you take the attendance when it is an online class?
Ma'am, we just note down the absentees, ma'am. In the column who have logged in, based on that, we note down the absentees, ma'am.
Okay, okay. Then bring the attendance to the department now.
Yes, ma'am. Okay,
Okay.
ma'am.
So we'll wind up the class for today. Next class we will continue with grids.
Okay,
Okay.
ma'am.
Thank you, ma'am.